Welcome to the show. I'm Kathy Ireland. Each year, nearly 80,000 cancer patients in the U.S. could be missing out on receiving the right, potentially life-saving treatment for their condition. Today, Diaceutics CEO Peter Keeling and Managing Director Steve Vitale join us to share more about how they're transforming the medical industry. Welcome, gentlemen.
Thank you, Kathy.
Thank you. It's good to be here.
Now, Peter, can you describe for us some of the current challenges with diagnostic testing and how patients are being missed?
Absolutely. I think it's a very human story. Many of us will have friends and family who have perhaps been diagnosed with a cancer. And often that diagnosis is an emotional roller coaster. For example, in lung cancer, the average time to getting diagnosed and on the right treatment is 3 years. In Alzheimer's, it could be anything up to 7 years. And some of the problems inherent in that is patients may not get access to the right test, or the test isn't reimbursed, or the doctor doesn't know where to send the sample to the lab. And this is becoming increasingly urgent. Today we have approximately 200 drugs on the market where there's a very strong test and drug dependency. But there's 5 times as many of these absolutely super drugs coming to the marketplace. And we really need to get the testing correct in order to make sure that this is right. And I think a very simple philosophy for us underpins this. Better testing will deliver better treatment outcomes, and we're pretty passionate about that.
And Steve, you've created that Diaceutics method. Can you give us a high-level overview of what that is and how it's changing the way the pharmaceutical companies around the world operate?
Yeah, absolutely. So the Diaceutics method is really a high-quality, consistent but patient-centered approach to uncovering a lot of those issues that Peter just mentioned, right? So each one of these targeted therapies or medication, personalized medicines that are coming to the market are going to have their own unique challenges. And so the method is an approach to identify what the hurdles might be, and then sort of applies a systematic way to analyze data and allow us to inform our customers to sort of lower those barriers and get over those hurdles so that the test becomes an enabler to the therapy as opposed to a barrier.
So the thing that's really interesting about Diaceutics is the visionary leadership that guides this company. You're talking about a team of people who 12 years ago understood what the impact of precision medicine and personalized medicine was going to be when other people weren't even thinking about it, didn't see it, couldn't see the impact. And so what they've done is they saw a moment in time. They were early to their customers. They helped brief key executives in the industry about what this innovation was going to mean for them. And then they have pivoted along the way to incorporate technology into their offering, data analytics into their offering. And I think they were the first to see the missing piece of incorporating the lab data so that they could bring the data back to the companies developing these drugs, and they could see what was happening in the field in ways that they could never see before. And not only did they understand that importance of the lab data, they were able to build a global laboratory network, which no one else has.
It's been set up with a clear vision from day one. That vision has, I think, manifested itself now into the delivery into the market of a product offering that really can make a difference. And I don't think there's anyone else in the market that is positioned that can have that range of product offerings from soup to nuts, if you like, in terms of being able to deliver better testing, diagnostic analysis, earlier treatment, earlier analysis. Really, that makes this company unique.
Peter, can you talk about the impact that Diaceutics is having on patient testing and associated outcomes?
Sure. We are very fortunate in the fact that we work with 30 of the top pharmaceutical companies like Novartis and Pfizer and AstraZeneca. And we work with them at the moment when they're about to launch a new test and a new drug combination. And that's almost the point where you can create the greatest change, because what we can now do is we can head off problems that would otherwise be encountered in a disease. Steve mentioned about the new drugs that are being rolled out. these new drugs have a very strong test dependency. And by looking at the disease and saying, we would anticipate that this disease would have A, B, and C problems, let's invest in avoiding those problems. Let's invest in better communication to the laboratory. Let's invest in better testing for that laboratory. And more importantly, let's invest in better communication to the patient about that testing. And we've looked across, we've worked on over 250 launch programs. And as we've looked across those launch programs and measured where we have created that change, our conservative estimates, we've helped around 500,000 patients get better testing. A lot of that is in cancer, but not exclusively. And I think that's hugely rewarding for us, for our team, to see that we're not just building a new type of a business, we're building that business and we're making a difference to those patients' lives.
Wow, that's extraordinary. And Steve, can you share more about how your comprehensive diagnostic landscapes, strategic integration and tracking services, how are they game-changing in the industry?
Well, so it sort of follows from the Diaceutics method. And we start by kind of taking a look around. So what's happening right now in the landscape using this real world information that Peter just alluded to. So we now have relationships with nearly 3,000 labs around the world. And we're able to leverage that information to derive data, data supported insights for our customers. And so by taking a look around, understanding what the landscape is, identifying the risks and opportunities, then we can build a strategy that's specifically related to the diagnostic, which needs to be integrated with the strategy that could be being developed for the overall pharmaceutical brand, right? So once you've got that strategy in place, then you can say, okay, what do I need to do to knock these hurdles down? How do I make the right investments? And what are the types of sort of tactical programs that I need to engage in as a pharma company to make sure, once again, that the test is not getting in the way. We encourage our customers to be the architects of their diagnostic strategy as opposed to letting others sort of do it for them.
There are tremendous benefits in having the best diagnostics out there to partner with the medicines that now exist in many cases, because then you can make sure that you can get the best medicine to the right patient at the right time in the most efficient and effective way. As a result, that will deliver significant savings to the healthcare system and quality and longevity of life to patients who need the drugs and the therapies.
We're improving the outcomes and the diagnostic journey of the patient, because if you're not tested, that means you won't get even the chance to be considered with a certain drug. If you are tested, then maybe you will be positive, maybe you won't be, maybe there will be a drug out there for you that is very targeted to your condition. But that's what it does. I think Diaceutics, by expanding the testing to patients and to more patients, really helps bring more treatment options to patients, and that's a key thing, as we've seen today.
There's life after a cancer diagnosis, and with the way that science is moving forward and researchers are working right now, I think there's hope. There's hope that we are going to outlive anything the statistics say.
Oh, excellent. And lastly, Peter, what's next for both the industry and Diaceutics?
Well, from an industrial standpoint, I think we're really just getting started. There are a couple of, I think, key goals I think that we collectively need to hit. The first goal is I think we need to articulate the value resident in diagnostics. We need to articulate the impact, the clinical and economic impact that better testing will have on healthcare systems, again, to help motivate that change. And I think the second one is very much about the patient's ownership of testing. So at the minute, this is an industrial discussion. It's an industrial between the pharmaceutical industry, the laboratories, the diagnostic companies. We need to shift that back to say that this is a communication to patients and to their caregivers, because there's no real reason why a patient should feel removed, one step removed from diagnostic and testing. Why can't they participate in the discussion? What's the right test for me to their physician? I understand that this test should be offered to me. Can I have that test? And I think by motivating and mobilizing the patient community, I think we will have that final domino, if you like, in this long line of changes. And once that falls, I think the world will shift towards precision medicine.
Well, Peter and Steve, thank you so much for this amazing work that is saving lives and getting the right medications into the hands of the people who need it most. Congratulations to you, and thank you for joining us.
Thanks so much.
Thank you. Thank you for watching. I'm Kathy Ireland.